Are you suffering from urinary incontinence? If you're 80 years old, it can be somewhat expected. If you're in your 30s or 40s, it's not typical, but it does happen. And about a year ago, we had a gal come into our office with sciatica and low back pain, and we got her corrected. And about 3 weeks in, she comes in and says, "Dr. Hall, I came to you for low back and sciatica, but I didn't tell you for 10 years I've been wearing diapers to bed because I'm incontinent. And I don't know what you did, but all of a sudden I can control my bladder." Now, to a lot of the skeptics out there, you might be saying, what the heck does upper cervical spine have to do with urinary incontinence? So let me explain. There's two types of muscles. There's skeletal muscle. That's like you flex your bicep. That's skeletal muscle, which you have conscious control over. And then there's another type of muscle. It's called smooth muscle. Smooth muscle lines all the arteries, which causes them to dilate or contract. It also lines the esophagus and the GI tract. You've probably heard of peristalsis. That's what moves food through the GI tract. In the bladder, where the urine exits, there's also smooth muscle, and there's something called a sphincter. The smooth muscle should be tight. It keeps urine in the bladder, but sometimes it's lost its normal tone and urine leaks out. That's what we call urinary incontinence. Well, that smooth muscle, whether it's in your arterial walls or in the urethra of the bladder, that's all controlled in the autonomic nervous system in the brainstem area. And so a structural misalignment at the base of the skull can impact the cord and affect smooth muscle, as it does also in cases of blood pressure. Of course, not all of incontinence and not all blood pressure is going to resolve by getting the upper neck corrected. But if you've exhausted a lot of alternatives and you're looking for a way of not only to help that, but also to overall help your health picture and your body function, a good place to start is the upper cervical spine. So hope this information has gotten past some people and will pique their interest, and they'll get into people who do this work, and hopefully it'll turn your life around for you.